This conference will now be recorded.
I wonder if I should cover them.
How are you?
I'm good, how are you?
Good, thank you. Very good.
Scared.
Trying to. It's difficult. It's really difficult.
It is.
Social distancing is really difficult for me because of me and my poodle. It's like I have friends I want to see and things I want to do, and it's like locked up at home. It's starting to wear on me a bit. So
You don't know who's been or what's.
no, you don't, and it's so scary because it's like you don't know. And I think it's just going to get worse before it gets better.
Yeah, and so many people just trying to downplay it.
Yeah,
Yeah. And by saying the media blew it out of proportion. I don't see that.
I don't see that either.
So
This
much.
conference will now be recorded.
This is Lindsay Kiesler, President and CEO of your chamber. And again, thank you all for calling in this morning. Also, thank you for your patience as we navigate new technology and new norms. We appreciate you taking the time. As I know, first and foremost, want to acknowledge the fact that this is a time of uncertainty and challenges for you all in the business community. And it's our goal, your chamber alongside of all of our hosts today and others, to bring you the latest and most relevant information that can assist you in navigating this time. I want to thank our co-hosts for today's call, Catawba County Public Health, Catawba County Emergency Services, the Catawba County Economic Development Corporation, the Small Business Technology and Development Center. To start off, I also want to remind you of several of the actions your chamber and our partners have taken to help assist you during this time. If you haven't already discovered it, we have created a business resource guide of everything related to COVID-19 on our website. You can access it by going to catawbachamber.org, and there's a big red box at the top of the page where you can click through to find this resources. We are updating it as soon as we receive the most relevant information. As you know, this is a fluid situation, and we're receiving updates almost hourly, certainly daily. So check back if you need to know the latest information. And we also are continuing to add resources to assist you and to point you in the right direction to help answer your questions and to help solve some of your critical needs at this time. Another thing, we realize that great strategies to get through this often really lies within all of us, and that includes you. And so right now we're in the process of working on a way to help provide a platform for you to share resources, share displaced workers, assistance, and other best practices to help each other. So that information will be forthcoming, hopefully in the next several days, or certainly in the next week. After this webinar series, beginning of next week, we're going to release an impact and support survey. So if you don't mind, I know there's a lot going on, but this really helps us hear from you. What are the impacts you're experiencing now, and also what is the support that you need during this time? And so that is going to really help us to customize support for each of you. So when you receive that survey, if you don't mind, please respond to that so that we can hear from you. In addition, I encourage you to engage with the various support local campaign efforts that are going on social media. Your chamber has launched an effort, and also other groups like the Hickory Young Professionals have launched efforts to help support whether it be local restaurants, retailers, or service providers. If you don't use social media, you have a sphere of influence in some way, shape, or form. So I hope that you will do your best to encourage those to support our local businesses during this time. I want to thank you for your partnership. Your partnership means so much to us, and I feel privileged to serve as your partner and link arm in arm with you through times like this. I also want to acknowledge the fact that there's an immense amount of uncertainty and difficulty that you're going through. Many of you are under extreme pressure and stress. And I just want to commend you. I want to commend you for your courage. I want to commend you for your bold decision making and being able to innovate your processes and your services and look for other solutions and other sources of supply chain. I've just heard time and time again stories over the last week of things that you have done to help get through this time and also provide and opportunities for your employees, because I know those situations are often, or those decisions are often the most difficult. But I want to offer you a message of encouragement and hope this morning. Our community has weathered challenges in the past, and this will be no different. You will get through this, but I think it's important to understand that we're in this together, right? I'm in it with you, your chamber's in it with you, and your local government partners are in it with you, and also your other economic development and community development partners. We're in it with you. So we are here. We want to help you. Please reach out. Also, set your gaze. I know mostly it's down right now, and hunker down to create solutions. But as the time goes forward, I challenge you to set your gaze outward and also upward, but outward to look out and see how you can share your resources and your ideas with a fellow business leader. But I know we'll come through this. We'll come through it changed. We'll come through it challenged, but most importantly, we'll be stronger as a community. So thank you for your courage and your leadership. Again, I want to stress you have partners in this, and I want you to reach out sooner than later. So if we can assist you in any way, you know how to reach me, and I would love to hear from you. So now I want to dive into today's part one of your business and COVID-19 of our two-part series. Many of you are registered to attend both parts. We do have a full house today for today's webinar, but we will provide a recording of this so that you can circulate it around your company or circulate it within colleagues within our community that weren't able to hop on it live. I want to give a couple other housekeeping reminders. Today, if you don't mind making sure that you're on mute throughout this session, you see the chat box there, but feel free to ask questions as we proceed through the presentations. We will have a Q&A session at the very end, and Nathan Hurett with the Economic Development Corporation is going to facilitate that Q&A. So anytime you have a question throughout the presentation, go ahead and put your question in the chat box, and we will get to those, as many of those as possible. More than likely, we won't get to all of them, but we will ensure that you do receive an answer to your question if you put it in this chat box. So without further ado, I want to give a rundown of our speakers, our presenters today, and then I will introduce our first presenter. So with us, we have Jennifer McCracken. She's the Interim Public Health Director. Shantae Lell, she's the Medical Lab Manager Preparedness Coordinator with Catawba County Public Health. Emily Killian is the Community Engagement Specialist with Public Health. Karen Yowsey is the Emergency Management Coordinator with Catawba County. And then finally, we'll conclude with Nathan Hurett. He is the Existing Industries Coordinator with the Catawba County Economic Development Corporation. So to start our presentation today, I would like to turn it over to Jennifer McCracken. She's the Interim Public Health Director.
Well, good morning. My name is Jennifer McCracken. Like Lindsay said, I'm the Interim Public Health Director for Catawba County Public Health. And I'm going to give you an overview about COVID-19. I know you've been hearing a lot about it. Certainly, you can't turn on a television, you can't turn on social media without it being front and center. So wanted to just describe what this virus is and what this situation is. It is an expanding outbreak of a respiratory illness, and it's a new type of coronavirus called COVID-19. So what we understand is that this virus originated in China back in late 2019. There was an animal to human transmission, and it began to spread across China and now worldwide. there have been certainly numbers of people who've been affected, and those numbers continue to climb, and those numbers change rapidly. But what I can tell you, at least as it stands right now in North Carolina, we have 63 cases. We have 0 deaths in North Carolina. Across the United States, there's 4,275 cases and 75 deaths across the United States. So there are no cases of COVID-19 in Catawba County at this time, and of course we monitor that hourly. The numbers on the state website, so on the North Carolina DHHS website, they're updated daily at 10 a.m. So the numbers I just shared with you is what was reflected yesterday at 10 a.m. and then before the end of this call, we should have updated numbers for North Carolina. So there are different types of coronavirus. There's 7 different types actually. 4 are really just kind of cause the common cold. They're in society every day. I'm sure we have all been exposed to those types of coronaviruses at some point in time, and so we've built up some immunity. Our bodies have built up some immunity to those strains. However, in the recent past, there have been 3 emerged strains of coronavirus that have been more problematic. So the first one being Middle East Respiratory Syndrome, otherwise known as MERS. Of course, SARS, which stands for Severe Acute Respiratory Syndrome. That's one I know we've definitely heard about in the news. And then COVID-19, which is certainly the virus that we're talking about today. So related to the symptoms of this virus, most people have mild symptoms. It causes respiratory symptoms such as fever, cough, shortness of breath, and breathing difficulties. When folks who have COVID-19 begin to get into the shortness of breath and breathing difficulties, that's really when we recommend that they would need to go seek medical care. But most people who get this virus really have mild symptoms, so that is good news. However, we know that it can cause severe infection, which can lead to pneumonia, respiratory distress, kidney failure, or death. So those are definitely the severe cases that can happen, and we'll talk about kind of the high-risk populations here in just a few more slides. So we know that this is a global public health threat right now, and that threat is high. However, for Americans, the immediate risk still remains low. Like Lindsay said at the beginning of the call, this is a rapidly evolving situation, and so what we say today could change by this afternoon. It could change by tomorrow. New information is coming out very, very frequently. And you'll see those numbers already have changed. So we now have 63 cases in North Carolina, and of course the death rate has risen across the United States, I'll say. So we're really concerned about high-risk populations. So those adults who are 65 and older who have underlying medical conditions such as heart failure, lung disease, compromised immune systems, and they're at increased risk of serious illness. And so what we know about that is that, of course, as people age, our immune systems, they change. It makes it harder for our body to fight off disease and infection. And also, many older adults are more likely to have some sort of underlying health condition that can make it harder for them to cope with illnesses that they come in contact with. And so it's especially important that we emphasize prevention measures, and we're going to talk more about prevention measures in future slides, but certainly that, hand washing, social distancing, those kinds of things are certainly important related to related to COVID-19. So children, that's a population that we tend to be concerned with related to any illness or virus, but this particular strain is not affecting children to the extent that it's affecting our older population or our immunocompromised population. And we think it's because that they are exposed to so many other types of viruses on such a regular basis that they have developed somewhat of a cross immunity to this strain. It doesn't mean that they cannot be infected with COVID-19, but it means that they typically do not have a very serious course of the disease and they recover fairly rapidly. But what we are concerned with about children is while they may have a very mild course of disease, they can transmit it to others. So if my child was staying home with a grandparent, for instance, and maybe they had the disease, and maybe they just had, just a slight cough, didn't feel well, they could pass that along to somebody who is over 65 or immunocompromised, and that's what we're really concerned with when it comes to children, is they really can act as a vector for transmission. So we want to protect them, we want to protect the public in general. So related to transmission, we believe that COVID-19 is transmitted through droplets in the air from coughing, sneezing, or talking. So you'll hear us talk about maintaining social distancing of 6 feet. This is why we want to make sure that people are covering their coughs and sneezes, maybe not with their hand directly, but with their elbow, coughing into a sleeve, or using a tissue. We also believe that it could be transmitted through an airborne route, which really could be by simply talking. So again, really, thinking about social distancing and what that means. There is some thinking that this virus could be contagious before symptoms begin. So a person who has COVID-19 may be able to spread it before they have symptoms. Of course, because this is such a new virus, they're still doing studies. There's still some unknowns about that, but I think it's something that we need to be aware of. So for treatment, it's really just symptom relief only. There's no antibiotic that treats COVID-19. There's no specific antiviral that treats COVID-19. For those severe cases, hospitalization or supportive care, for instance, through mechanical ventilation could be necessary. But again, for most cases, those are mild and do not require hospitalization. 80% of the population who are exposed and have COVID-19, they recover without incident. It's 20% of the population, which are those who are most high risk, that we really remain concerned about. So we have a lot of unknowns because this virus is still so new. It's unclear how easily or sustainably that the virus is spreading between people. Community transmission is being studied. We have no evidence at this point in North Carolina of community transmission. However, our state leaders and partners feel that this could be something that's happening, but we just have no evidence of it. There is a possible vaccine in the works, but that could take up to a year or more in order for that to take place. It's unknown how long the virus can live on surfaces. It could be hours or days, and again, there's still studies being done about this. So as we talk about in future slides about maintaining a clean workspace and those kinds of things, that's really important because if virus is living on the surface, we want to clean and make sure that we kill that virus. The other unknown is that the severity of the illness, we just don't know how many people will fall ill at this time. And the death rate is hard to pinpoint. So you're going to hear different death rates in the news, on social media and those kinds of things, but because the numbers are still changing so rapidly, that's a hard number to pinpoint. So related to state guidance, this just gives you a few bullet points about what's been coming down from the state. Of course, we know on March the 14th, Governor Cooper issued an executive order to close K through 12 public schools for a minimum of 2 weeks. There's also an education and nutrition working group that's working to develop a plan to ensure that children and families are supported while schools are closed. There was the information about canceling and reducing large events and gatherings to under 100 people. The suggestion was to use telework technologies to the greatest extent possible, and I know between today and the session tomorrow, we'll talk more about that, as well as staggering work schedules. arranging workspace to optimize the distance between employees at least 6 feet. Again, that's to accommodate social distancing. It's a good idea to review those absenteeism policies to make sure that when employees are sick that they're not being encouraged to come to work. We also want to, encourage folks to self-monitor, let people know what those signs and symptoms are. And certainly they can self-monitor themselves before they come into work. And also work to make sure that fear and anxiety doesn't lead to social stigma towards any employees. And lastly, make sure that you're getting reliable information from sources like the CDC, from North Carolina Department of Health and Human Services. Of course, Lindsay's already talked about the resources, that she's developing on their website. So look for good, reputable resources that's going to give you the correct information. On March 17th, Governor Cooper issued an executive order to close restaurants and bars for dine-in service, takeout, and delivery only. However, grocery stores and pharmacies will continue to remain open. And there is going to be more guidance forthcoming related to unemployment benefits and those sorts of things. And I know that we'll have a discussion tomorrow about that. So certainly if you have questions related to that, you definitely want to tune in tomorrow. So just to give you a sense of what public health is doing, and, I can tell you that we really, we are used to investigating communicable diseases, and COVID-19 is a communicable disease. And so we have the structure in place already to monitor, investigate, to do community surveillance for diseases that are in our community. So when we heard what was going on in China late December, very early January, we began having communication with area physicians on the disease itself, on screening, testing procedures, and then the state made COVID-19 a state reportable disease, which means if there is presence of disease in a case of COVID-19 in our community, it has to be reported to the local health department. We began communicating with nursing homes, assisted livings, those congregate care facilities that take care of some of our most vulnerable citizens, and we started working with them on education as well, along with first responders in terms of screening and infection control practices. We convened our in-house EPI team, and that's a multidisciplinary group of folks, many of who are sitting with me today who will be speaking, and we are specially trained in communicable disease response and incident command and those sorts of issues. We participate in at least weekly state conference calls. We have a very robust Division of Public Health at the state level, and they have worked very quickly over these last several months in getting us, information and education in order to be able to bring back to our communities. Of course, we've been communicating with the business community, fielding questions, speaking about overseas travel and those sorts of things. We've also provided information to the local information team in Catawba County, and that's a group of public information officers that meet together, so folks have consistent information and can have consistent messaging across the county. Of course, we have been providing ongoing communication with the media, pushing out education to the public. Emily Killian, our public information officer, is going to talk to you in a bit, but we have developed a pretty robust resource list on our Catawba County Public Health website, and that's also a great resource for you to utilize. We have been working over the last couple weeks, in particular, convening different groups of partners. However, because we do not want to gather in a group of 100 or more, this is the reason why we're doing this webinar. So we actually had to move our healthcare, our meetings, our face-to-face meetings, to now this online format. But we've met with healthcare providers, we've met with other community partners, with the faith community, with congregate care partners, with first responders, with the child care community, really discussing these same types of issues with facts about the disease, infection control information about communication, as well as continuity of operations. And with that, I'm going to let Shantae Lell, our Medical Lab Manager and Preparedness Coordinator, talk with you about infection.
Good morning. Excuse me. So I wanted to point you to two specific websites that I'm using to pull guidance from. The first one's the CDC, and it's the Interim Guidance for Business and Employers. The second one is the North Carolina Department of Health and Human Services. They actually have interim guidance for environmental cleaning for non-healthcare settings following exposure to a patient with confirmed or suspected 2019 novel coronavirus infection. I would remind you that this is a rapidly evolving situation, and it's probably a good idea if you're wanting the most current guidance to check those websites to ensure that that guidance has not been updated. So some basic infection prevention, and this is going to be applicable to any situation where it's a communicable disease, but specifically COVID-19 that we're talking about today. Please take the time to review and re-educate your employees on sick leave policies. The encouragement piece is that the policy should not be punitive, but rather you want to encourage your employees to stay at home when they're sick. Again, use teleworking technologies as much as possible. Consider canceling non-essential travel if you've not already done so. Consider reducing larger congregate groups of employees at your businesses. This can be accomplished by staggering the work schedules so that, for example, on half the people will come in on one day and the other half of the people would come in the second day. The people that aren't at work are actually teleworking. Alternately, you can change their work hours potentially. If they are at work, you want to try to arrange workspaces so that there's a minimum 6-foot distance between workers. This should also be applied when possible between workers and customers. The biggest thing that you're going to hear us say probably 100 times is to perform hand hygiene often. You can always wash your hands with soap and water for a minimum of 20 seconds or use hand sanitizer. If your hands are visibly soiled, you should always wash your hands. Hand sanitizer, some people are having a more difficult time obtaining that, so we would always recommend washing your hands at that point. And you really want to make sure that you wash those hands before and after you go to the bathroom, before you're preparing food, eating, taking care of someone else, before you leave for the end of the day, anytime you blow your nose or cough. And when you're leaving at the end of the day, you want to be cognizant of the surfaces you're touching on the way out. Again, a gentle reminder that you've probably heard 20 times, do not touch your face, specifically your eyes, nose, and mouth. If we can get in the habit of not touching our face now, it actually will help stop the spread of infection later, regardless what the infection is, if it's passed by droplet. Those 3 points of entry actually can infect you, so stay away from your face if your hands aren't just freshly washed. Cover your cough or sneeze with a tissue and then throw it in the trash and perform hand hygiene. Again, wash your hands for at least 20 seconds. 20 seconds is a long time. There are references on the CDC website for songs that you can sing to meet the 20-second requirement, and you're really trying to provide the friction in all the areas on your hand to ensure that you're getting the germs removed. And you want to clean and disinfect. Think about those common surfaces that are touched frequently: signature pads, common pens, door handles. As you're leaving the building for lunch or at the end of the day, are you using a paper towel to touch those on the way out? Are you using your elbow? If you are using your hand, you've just reinfected your hands. So specifically, if you're looking at cleaning and disinfection recommendations after you have a known or suspected COVID-19 person in your area, you want to restrict access to that contaminated area until it's thoroughly cleaned. And that would include counters, tabletops, doorknobs, bathroom fixtures, toilets, phones, keyboards, tablets, bedside tables, anything that person could have touched. You want to minimize the number of people who are exposed. So if possible, you just want to designate one person to clean the area versus 10 people who take turns cleaning. Always make sure that you're wearing the appropriate PPE. That's going to be guided by what disinfectant you're using, but you at minimum should always be wearing gloves. And again, wash your hands immediately after removing those gloves. I'm sorry, we're having technical, there we go. Okay. So this is specific guidance on non-porous, porous, and launderable items. You want to clean any surface that may have blood, body fluid secretions, or excretions on them. So my recommendation at Public Health is if it's wet and not yours, you don't want to touch it without personal protective equipment. That probably should be the mantra that everybody follows. If you have non-porous substances, clean and disinfect those areas with products approved by your company. If you have porous, which are soft surfaces such as carpeted floors or seat cushions, you want to remove as much of the contaminant as possible. Cover the area with an absorbent substance such as paper towels to contain as you're spraying you have to clean first, then disinfect. Then you're going to remove the absorbent substance and any remaining material and clean and disinfect the area with products approved by your company. For things that need to be laundered, you want to read and follow the labels of those items. You want to wash on the warmest setting possible and dry on the warmest setting possible as well. At the end, place all waste that's generated inside a plastic bag and tie a single knot or tape to prevent from leaking and place into your garbage receptacle. Again, I want to highlight these common surfaces that even if you don't have a COVID-19 patient, it's a good practice whenever we're trying to encourage people to wash their hands, to have someone designated to clean the doorknobs, clean the light switches, clean the desk, clean the faucets, any surface that is touched on a regular basis. And always follow your label directions of the disinfectant that you're using for the appropriate contact time and the required PPE that's required. And now I'm going to pass this off to Emily Killian, our Public Information Officer.
Great. Thank you, Shante. So I wanted to discuss a little bit today about communications techniques and some resources that are available to you to help you communicate better with your employees, with their families, and with other stakeholders. So the best thing to remember is prevention. Every day, everyone, every time. And if you can encourage folks to follow that, that will be very beneficial. So our overall focus as public health has been on prevention messaging, and so we would hope that everyone else is able to follow in our footsteps on that. So the steps to preventing coronavirus transmission are very similar to the steps to preventing other respiratory illnesses, such as the flu. So with that emphasis on prevention, you want to, and I'm sure you've heard this 1,000 times already, but you want to encourage folks to wash their hands often with soap and water for at least 20 seconds. If that soap and water are not readily available, folks can use an alcohol-based hand sanitizer. Avoid touching your eyes, nose, or mouth with unwashed hands. Avoid contact with others who are sick. Cover your mouth and nose with a tissue, as Shante said, and throw it away. Or your sleeve, but not like near your wrist. That needs to be more of your elbow or upper arm. And then we actually have a more complete list on our public health website's Coronavirus 19 tab. And it is worth noting that the information there is in English and Spanish. So it is available in both those formats. So other recommendations are for folks to be thoughtful about what they read or hear about the virus and make sure you are separating rumor from fact before you forward information to your clients, students, parents, caregivers, your staff, and just in general. So make sure that it is coming from a reputable source, and I will point you to several reputable sources here in a minute.
We also want to be cognizant that while some people can be worried or have concerns, we don't want to let that fear and anxiety lead to social stigma toward individuals or groups of individuals. So just be on the lookout for that and make sure you don't play into it. From a communication standpoint, we want to encourage that communication of prevention measures and other helpful information with your staff and stakeholders. So make sure they know that there are things that they can do to help prevent the spread. And then our public communication, we are carefully guided by North Carolina Department of Health and Human Services. And so we consult with them regularly to make sure that we are providing a consistent message within the state and with Catawba County residents. And one of the concerns that we always have is the protection of patient privacy. So we do have to keep that in mind. Our recommendations for you are that you let us know if there is something you need and can't find. There are lots of times where I've been on the CDC's website or the state's website or another place, and so I know where things are located that you might not be able to readily find. So let me know if you're struggling. Let us also know if you see or hear of a weird rumor or something concerning. We do want to keep a finger on the pulse of what is being said out in the community. We want to encourage you all to use credible sources, and to do that, there are fact sheets, flyers on hand washing, some other public information resources for different sectors, including businesses, and those are available. Well, if the slide will go. There we go. Too many. All right, so those are available both on the North Carolina Department of Health and Human Services website and also the CDC's COVID-19 website. So we have those addresses there. The North Carolina website is pretty easy to navigate. It has all the different sectors broken out into blue boxes. So those blue boxes, for most folks, are going to be below the scroll. But once you get into those, it should have kind of a comprehensive list of what you need to be looking at. For the CDC's website, it is divided into 3 sections. So there's a section on the left of what you should know. There's a section in the middle that are situation updates. And then on the right-hand side is information for specific sectors, including businesses. The other really great resource that is available is the North Carolina Poison Control's COVID-19 hotline. So that hotline is manned by some of the same staff who have been manning the regular poison control hotline, so they are very well versed, but they are available to answer some general questions, especially for people who are just asking questions or who are concerned, who may not be having symptoms. So those are for asymptomatic people who are just asking, kind of general questions. And then the other great communications resource is going to be the Catawba County Public Health website and Facebook page. So if you have not liked us on Facebook, please feel free to do so. We are pushing out some really great messaging there, and that is some easy information that you can share with folks. And then the website, as we said before, does have information in English and Spanish. And then I'm also available as a resource to you, so feel free to reach out if you have the need.
Good morning, everybody. This is Karen Yowsey, and a lot of you hear from me when we're having floods and tornadoes. We've just shifted how we're doing business here in Catawba County because every day we take an all-hazards approach to emergencies and disasters, and so a public health emergency, a pandemic, rolls right into our cooperation with other agencies within Catawba County government and other agencies across our municipalities as well. So I was asked to talk about continuity of operations planning, which I know is not anybody's favorite thing and can be a snorer. So let me go kind of quickly through some of this information, try and get you up to speed on where we hope that you will be within the next day or two with your information and planning in your organization. Typically, when we're looking at business disruption scenarios, we're talking about events that have happened that have damaged your facility or made your facility inaccessible for some reason. So, for instance, the tornado last October, the flooding last June, those kinds of things are the typical things that we talk about in emergency situations and business disruption. However, in this, we are actually talking about things that disrupt business because of your human resources concerns and potential issues. We don't right now, but we might have situations where you could have restricted access to your buildings and facilities. So that's one of the highlighted bullets. I think we're all experiencing an interruption of the supply chain. I know we are as government. I know our healthcare partners are experiencing it. I know anecdotally that I'm hearing about situations in grocery stores and the big box stores like Lowe's and Home Depot and those kinds of things. So I think we know that that's happening as well. That is more because of transportation concerns and less about an lack of availability of the actual product or resource. Right now, we're not seeing any utility outages, but that's something that we monitor every day anyway and kind of keep track of. We are also not seeing a lot of interruption in communications, things like phones, cellular service, or internet. However, I am anecdotally hearing reports out of Europe that because there are so many people staying home watching Netflix, it is actually slowing down the overall internet capability of everybody in Europe. So that's something that we'll be watching as we go forward as well, because we know that there's some essential services that rely on internet capability. The really big one that we're worried about is absenteeism of essential employees. So we're going to talk a little bit about that here in the next couple of slides.
Okay. Gotcha. I got you.
All right. So what is continuity planning? The focus of continuity planning in a pandemic is on human resources. We are hoping that all our infrastructure and our facility structures themselves stay intact and whole, but we really are focusing on human resources. And one of the things that I want to talk about are planning assumptions. And one of the big ones is, or two big ones, how many people will be out because of this and how long will it last. So we're going to talk a little bit more about that in a minute. All continuity planning should be focused on maintaining essential services. We all have things that we like to do, and most days of the year can provide really well to our customers, but this may be a situation where we change our focus or scale back what we're doing so that we can maintain those essential services. Planning assumptions, and I want to say these are assumptions. These are things to create kind of a baseline for you to think about, wow, what could happen in our community. I am not saying these are going to happen. We could end up on being much better off than these assumptions. The other piece of that is we could end up being worse off than these assumptions. But this is something to think about and stimulate your planning and your thinking as you go forward. We are looking at the infection rate in the general population being somewhere around 25%. That's something for you to plan for. Currently, the mortality rate in the United States is between 2 and 3% of those infected. Again, that's a really fluid, iffy number and is based on the total number of cases. And so we will not really know what the mortality rate is or the infection rate is until this is all over. But things to think about. Workforce absenteeism is probably something that we all need to pay more attention to. 40% or higher. And you may be sitting there saying, well, hey, wait, you just said the infection rate could be around 25%. But if you think about an individual who is a caregiver to a child or to an older adult in their home or whatever, that's where you get that higher absenteeism rate. You get the folks that maybe are not feeling well. They don't necessarily have COVID-19, but they're not sure, and so they self-isolate. So your absenteeism rate could be much higher than the actual infection rate. We know that this is going to require a comprehensive strategy, and certainly here in Catawba County government and with our municipalities, we are doing this. It's going to require all levels of government. One of the reasons we're doing the call with you all today is because we need our business and private sector partners to be dovetailed in with us on the planning and response for this. We've spent some time talking with non-government organizations, and we really hope that you all will help us roll the public into this being a comprehensive strategy across Catawba County. One of the things that I've been telling folks for probably a 3 weeks now is that there's no way an individual, a single organization, a single business can solve this problem, and Catawba County is going to solve this problem for Catawba County as one whole community. We do know that the local health infrastructure and its resources, including public health, including our hospitals, including our nursing homes and adult care facilities, even our child care facilities, are fully committed to providing the treatment and resources necessary in this COVID-19 situation. We know that state and federal resources, some things may be available, some things may not be available in the level that we need this to support a widespread outbreak should it happen here in Catawba County. So a lot of our planning assumptions are based on what we think is reasonable to come to support us and what we're going to have to deal with together as that whole community. We also know that the non-pharmaceutical interventions that Jennifer was talking about and Shantae were talking about are going to be the most important in impacting how widespread COVID-19 becomes in the Catawba County community. So that's, again, back to, is everybody doing hand washing? Is everybody practicing social distancing? And on that note, I wish you could see our room this morning because we've got our 5 or 6 speakers and everybody's spread 6 feet apart. So we're practicing it all the time here as well. But doing those good non-pharmaceutical interventions are going to be the key to success in Catawba County. So we have this wonderful opportunity right now, today, Thursday, March 19th, here in Catawba County, to plan and for you all to plan. A plan begins with a piece of paper and a pencil. It doesn't have to be some big sophisticated thing. It really is starting to make yourself a checklist. What kinds of things do you need to have in place? What do you need to be doing to mitigate COVID-19 in your business and with your neighbors? But some key things to think about. We are looking at this as having a general impact across the community, and it could increase in numbers of cases and that kind of thing, and then we could see it level out or die down for a while, but there is also a potential for episodes to reoccur. And we're also looking at this as 18 to 24 months of disruption. Now, we may stop seeing new cases in the United States, but it will take a while for supply chains to get reestablished, for businesses and agencies to come back online to the level that they were prior to when we started this response operation. Strategies that we can see, and some of these we're actually starting to see, limited movement. We know that that is happening in intense ways in some parts of the United States, not so much in North Carolina, but some of the things that are happening, like the transitioning of bars and restaurants to takeout or outside ordering, delivery kinds of things, are a way to limit movement if people aren't sitting side by side next to each other. We've already seen reduced or stopped travel in the United States with ceasing a lot of the international travel. There was some discussion at the federal level 2 days ago about limiting travel within the United States. I think we'll continue to hear some of those conversations. Social distancing, wonderful, wonderful thing. That's a good thing. Alternate work locations. We are starting to see more and more of our business partners, our government agencies, doing alternate work locations. you have an opportunity right now, today, because we don't know when this is going to become widespread in Catawba County, to start adjusting your business flow, to start looking at your financial processes. Do the people who process payments and do disbursement vouchers and procurement orders and things like that, do they have to be in their office to do that? Could they do that in an alternate location? Can you provide that distancing amongst people in your office? Can you shift work schedules so it's a different person each day who's doing the hands-on, more face-to-face kind of work, and allowing other people to have some time where they're not exposed to the public or not exposed to things that are coming in and deliveries, vendors, suppliers showing up, things like that. If you are working with alternate work sites or trying to support alternate work sites, some key things are: what technology do they need to do that? What kind of communications and policies would need to be in place? And while you're looking at your technology and communications in alternate work locations, you do need to be cognizant of the fact that there are some bad people in our world who are trying to take advantage of us shifting how we do business through online scams, phone scams, a heightened sense of awareness of people trying to do cyber attacks on businesses and government that are focusing on addressing the coronavirus outbreak. And so you don't want to reduce your cybersecurity practices. You want to try and maintain those at the same time you're offering people alternate work locations. You need to consider when you're doing your plan that your resource support will be compromised at all levels. No doubt you all have invested a lot in your facility, in your technology, in your equipment, in your processes. So that's something to be putting at the top of your list of things that you want to look at. Vendors, we are already probably seeing some vendor changes just because of social distancing and alternate work locations, so that's something to keep in mind. And you want to look at all levels of your organization, not just your management, not just your employees, but both. Does your business utilize outside services? For instance, do you employ an outside custodial or janitorial service to do your cleaning? Do you have temporary workforce that's provided by an outside service? Things like that you need to be examining. What are you going to do as this coronavirus advances across the United States? You need to talk about delivery practices and transportation. Is there an alternate way that you can allow suppliers to deliver to your facility without actually getting face-to-face with them, a different way they could come in a different door, a different drop-off location for packages and deliveries. We are not anticipating much critical infrastructure impact in the way we would in a tornado or a flood, but we might somewhere down the road see impact if significant amount of personnel related to the infrastructure is not available to do the regular maintenance and operation of whatever it is. And you can think utilities, you can think roads, bridges, those kinds of things, your folks that come and empty the dumpsters at your locations. There are definitely greater challenges for us, and there's probably no more important challenge than ensuring worker safety during this. I mean, our employees are our greatest commodity, and we need to ensure their safety, and at the same time acknowledge that there's a significant amount of fear out there, and that we need to find ways to support them emotionally during this constantly changing, today we're doing it this way, tomorrow we might be doing it differently, world that we are living in right now. We need to plan on how we're going to maintain integrity of facilities. The security of your facility itself, the security of the equipment, critical materials, and I'm especially speaking to those of you that have hazardous materials inside your facilities. We know that federal and state regulations don't let you off the hook about your regularly daily logging of the security of those materials. And we certainly don't want to make this situation worse by having some unfortunate hazardous materials incident during this outbreak. So we want to make sure that we're keeping that up. We will definitely be working with our manufacturing facilities that have hazardous materials or have facility needs for security reasons to get back and forth to your facility no matter what other things are implemented across the county or across the state. Right now today, if I had to ask you to do one thing, it's update your contact list. Your employees, your vendors, your key partners. Lots of times we only share our office phone number. Now may be the time that we share and put on our contact list the cell phone numbers, because you may have to tell your key partners or all of your employees at an off hour that, hey, we're not going to do it the same way tomorrow morning, so here's what I need for you to do. And when that moment hits is probably not the time to think, shoot, I didn't check and see if Lindsay had changed her cell phone number yesterday or not. This is a really, really important piece. So dusting off your plan, and I hope you already have a continuity of operations plan. But again, if you don't, it's okay. Start today, one piece of paper, one pencil. Get a group talking, hopefully by conference call, that includes all levels of your organization. And I'm going to make a pitch here. The folks that empty the trash and clean your facility know things about you and your facility that you may not even realize are happening. So all levels of your organization, not just your key leadership, need to be involved in saying, hey, what about? Should we look at this? How are we going to do that? Because you will have a stronger plan and a more cohesive work team if you do involve everybody or at least all levels of your organization. Ensure your essential functions, those things that you have to do to keep your business running, are identified in your plan, and keep that up to date. Cross-training is a wonderful, wonderful thing. And often when we think of cross-training, we think, well, I'm going out on vacation for 2 weeks. I need to tell Jennifer what it is I do and see if she can check the mail or whatever while I'm out these 2 weeks. What if Jennifer and I are both sick at the same time in this? When somebody is sick is not the time to be saying, hey, how do you do that? Or what is the code for? Try and aim for 4D, because we know that there's going to be disruption as this becomes more widespread in the United States. It's okay to call your vendors and ask them what their continuity plans are, because if they say no, okay, what are we going to do instead? And if they say, yes, we've got a continuity plan in place and here's what it is, you might sleep better tonight. You need to establish clear lines of authority and implement a command system. Who's the final decision maker in your organization? The one who can say, this is what we're going to do. And if they aren't available, who's the next in line for that? When I was doing a talk similar to this 2 weeks ago, I actually talked about the key decision maker for Catawba County being in the hospital on a ventilator. We probably can't go get his signature for a delegation of authority. So go ahead and put those in place. Think about it from a financial perspective, from a business continuity perspective. Who can sign checks? Who can authorize things to happen at the bank? And make sure that you have some depth in that plan. If you're considering alternate work arrangements, telework, be sure you have some policies around that. In the short term, it seems easy, but in the longer term, what are the potential pitfalls, and how can you head that off by establishing policies now? Are you considering closing or consolidating service delivery locations? And we've talked a lot about this with some of our childcare partners, some healthcare facilities that have multiple locations. Does your business have multiple locations? Could you consolidate service as you start to see employee absenteeism to keep at least some cash flow coming in for your business? I've added the last bullet because this is a plea pretty much year-round for me, but especially now. Are you able to access your continuity plans, your contact list facility diagrams, things like that from your outside locations. So can you print a copy and put it in your trunk? Can you take it on a jump drive and a laptop and take it with you? Because if we have a reason to have to roll up outside your facility in the middle of the night, having somebody who has that plan, who's outside the facility, is important, and it helps the whole process of response go so much better. But you don't want to realize when you can't get to your building because of what's going on in the community that, oh, gee, I left my contact list of all my employees behind somewhere. So please think about a way you can do that. And that's all I have. I think we have a couple of questions, and
receive a couple of questions here. I'll just read them off, and I'm Nathan Hewitt with Catawba County Economic Development Corporation, and happy to be here. Wish we weren't here, but glad we have a lot of people on the line trying to get informed about this. Couple of questions. Is there any news if schools will return this year? I kind of open forum that for anyone that, or how long social distancing will be encouraged.
So this is Karen, and no, there's no news. The initial decision by the superintendents in Catawba County was to go through the end of March and revisit the discussion. So I would imagine sometime next week, based on the epidemiology on the ground and what's happening across North Carolina, there will be more information about that. So that's kind of a stay tuned reply to that.
Got another one, and I'll just read it off and question. Can we go through the current process if someone has a test? The last I heard, the individual will be quarantined. At the time the results are received, there are two responses. If positive, the DOH will work with the employee, and if it is our employee, the employer, to determine close contact.
One of our communicable disease nurses, Dory Maltba, is going to answer that question because she's working very closely with the testing situation. She's coming up closer to the phone so y'all can hear her. Can you repeat the question?
Yeah, I'm going to repeat the question just because I read it quickly. Sorry. So what's the current process if someone has a test? Last I heard, the individual will be quarantined. At the times, two responses. If positive, the Department of Public Health will work with the employee, and if it is their employee, the employer, to determine close contact. So kind of what happens if it's a positive test.
If it's a positive
If it comes back to the employer, will you all work with them in some way?
We will be working to determine contacts of any positive test to determine if those people are at risk and, yes, be in contact with the employee and employer.
And regarding our contact with the employer, we'll certainly be able to advise you at that point related to other contacts and those kinds of things, because if we do have a positive case, we will be doing a contact investigation. And that's very much in close contact working with our state partners with the Division of Public Health. So we do this in other communicable diseases. It's nothing new for us. We just have not, thankfully, had to do it with COVID-19 since we have no cases of COVID-19 in this county yet.
Did get the question that will these slides be available after the fact? And yes, we will be sending these out to everyone that registered. Plus, we'll put these up in probably a couple different spots, but I know the Chamber's website, they've got at the top, if you go to the home page, big red button that says COVID-19 updates. If you go there, we will probably put that up later this afternoon. I'm not seeing any further questions, and obviously want to be respectful of your time. So just real quick, wanted to thank everybody for hosting this morning. Chamber of Catawba County Public Health Emergency Services, EDC, and the Small Business Technology Development Center. Want to remind you of the actions the Chamber has taken to assist during this unprecedented time, and all of these partners that you've heard from this morning, and will continue to work together. Again, we will be sending out the slides, but there will be a kind of centralized business resource Again, I mentioned the Chamber's website. They've taken the helm on putting that information out there, and it's constantly updated. And if you continue to have other questions in the future, please feel free to reach out to any of the partners that you've seen here today or heard from. I believe we speak for us all when we are all very willing to talk through a very unique situation and want to be there to best assist you all at this time. So, and again, last thing is there's a part 2 tomorrow. We're going to go over a lot. I saw some more kind of business-related questions regarding Executive Order 118, unemployment insurance. That is such a moving target right now, but we'll have some great information for you tomorrow. 9 o'clock, hopefully no technical issues like today. We'll get that figured out. And again, same process. Those slides will be available after the fact. Appreciate everyone's time this morning and hope everyone has a great day and stay safe, obviously. Thank you.